Good morning. Here I start with my next lecture on GIT. So here, taking the topic from starting, once I consider GIT, it's a very big system, GIT, right? So we'll start from the top aspect. Now, coming here, when I take GIT here, I have to start always from the mouth. So it starts from mouth, esophagus, stomach, you have got intestines. Okay, small intestine, large intestine, again we divide. Again one more organ which comes here is liver, pancreas. They do specific functions here. Okay, we'll go one by one accordingly. But first, in GIT, I'll start from the mouth. Oral cavity. Oral cavity consists of what? So here we have got teeth, tongue and all the structures. But here, one question which is commonly asked to you is about here something called salivary glands. Salivary glands. Now what are the salivary glands? They are the one which secrete saliva. So there are three major salivary glands if I take, and these three glands are, okay, so I can parrot it. Submaxillary, sublingual. So I have got three main glands. They are parotid, submaxillary, sublingual. Now, out of this, parotid gland is the one. It is one of the largest gland. And okay, so let's see where it are present. These are the ones. Parotid glands are the one gland which are present in front of your ears. Okay, in front of your ears. There are a lot of cheeks. So here you can get here. Then submaxillary. Okay, submaxillary. If you see, it is as the name suggests. These glands are located in the submaxillary triangle, medial to mandible. Okay, simple way I can say. Now here, what they do is, so they are going to secrete their secretions. Okay, or they are going to put their secretions. Now here, what happens is, when I take the parotid gland, it is going to put its secretions via Stensen's duct. Stensen's duct. And when I take submaxillary, it is going to put through Varun's duct. Varun's duct. So this is a duct system. Then if I take my next, it is sublingual. Okay, sublingual gland, they have got multiple openings. Okay, the ducts like, and the one of the biggest opening which comes is called Bathory's duct. Now this is about the opening. Now how do I classify the glands here? These are nothing but these are the glands which mainly secrete your saliva. Okay, so these are salivary glands. Other than this, we have some minor glands, but that is not, I'll not go into detail. But if you remember this much glands also, it's more than sufficient. Next, how do you want to classify these glands? So when I see the structure wise, I can classify in simple way. I have to use one word. Okay, I can say is simple word MMS. So all of you are aware of MMS, means multimedia messaging. So M stands for what? Mucus secreting glands. N stands for what? Mixed glands. S stands for what? Serous glands. Yeah, mucus gland, mixed gland, serous gland. Okay, so as we know, serous, it is more thin. So the secretions of serous gland will be more thin as compared to the mucus gland. Mucus glands are the one which will be more thicker secretions. The secretions will be thicker. And then if I say other mixed glands, they have got both the things. Okay, they are having double functions. Okay, it will be having mucus plus here salivary. That is serous. It's a mixture of these two. Right. So next. So this is what you are aware of. Next, structure wise, I'll be taking up the coming up lectures. But before that, one more question I want to clear about is, there is something called functions. So what are the functions of saliva? Functions of saliva. So again, a list difficult to remember. Here you do common mistakes. So half the time you are not able to remember everything. Same way I told you in the earlier lecture, the first lecture of blood, how to remember. Same thing I'll tell you here also. Now, when I had to see, okay, as you all know, before that I'll come. Most of you have got hobby of watching movie, or by here and there means you have watched the movie. So most of you might have watched the recent movie, that is Happy New Year, right? So there is one competition they compete, that is WDC, World Dance Competition. That what we have to remember. So here, in order to remember that, I'll tell you one simple word. So that is best WDC. So D. So best world dance competition. This is one way. Okay, it is more comfortable for those people who have got habit of watching the movies. But for example, if you are not well acquainted with the movies, so you can say world's best city. It's as you wish. So let's start. So if I see, okay, so I will start here. So I said best WDC. Best WDC. So let's see what everything stands for. Right. So let's say, okay, I will go one by one. So as we know, the most important, the foremost functioning of saliva would be swallowing. So here comes. Okay, swallowing. Swallowing is the biggest function of saliva because it is very, you cannot swallow the food directly dry. So your saliva is very much important to cause swallowing of the food particles. So S stands for swallowing. Then, okay, T. T stands for taste. So all of we have habit of, so on the tongue there are papillas. It helps in identification of taste. It helps in identification of taste. So that is the another function of it. Right. So that is another function. T stands for your taste. Okay. So we have got two functions. First is swallowing, taste, and then D. D stands for digestive function. Digestive function. Okay. D stands for your digestive function. So it mainly helps in the digestion of the food substance. So here your saliva which is there. Okay. So it contains one enzyme. Okay. You have got salivary amylase, which will start digestion of food substance in the oral cavity. So you have to remember that the carbohydrate digestion starts in the oral cavity. Now it is not able to take place completely because food remains for a very short interval of time in the mouth. That's the reason. Okay, it will not take place completely. So you have got some of the food particles which will do. Next. Okay, next I should know is, okay, so digestive is over. Okay, I have got swallowing function, I have got taste function. Okay, then, okay, what are the other functions I should be aware of? So next, most important function is we have got cleaning functions. Cleansing the mouth. So the saliva is secreted at a rate of 1 ml per minute. So due to this, what happens is there is regular cleaning of the mouth. It is rinsing of the mouth. Saliva is very essential for your other functions. Antibacterial actions also it goes on cleaning the mouth. Okay, whether you eat the food or don't eat the food, it is produced at the rate of 1 ml per minute. So cleansing function. Then, okay, what remains is B, E and W. Okay, three more alphabets which are remaining. Let's see. E. E stands for excretion. Okay, it is going to help you in case of excretion of few of the metabolic waste products. Okay, that is one function it does. Then, okay, B stands for body temperature. So in human beings it is not so, but in lower animals it is more marked. So body temperature is one of the biggest function. Last, W stands for water balance. Water balance. It is also very essential to maintain the water balance inside your body. So it also helps to maintain the water balance. So these are the main functions here. So let's see what all things I have told. How to remember the function of saliva is for simple word. It is say best world dance competition. Right. W stands, okay, so B stands for body temperature, E stands for excretion, S stands for swallowing, okay, T stands for taste, W stands for water balance, D stands for digestive function, C stands for cleaning function. Then some more time you are getting confused. What about the nervous control, or how we can say it is controlled, the secretion of your saliva? First I understand is it is not under my voluntary control. In simple word, I have to see that it is a ANS, autonomic nervous system. Now when I say autonomic nervous system means it is sympathetic and parasympathetic. Okay, these two fibers will come into picture. So let's see. So I have got sympathetic and parasympathetic fibers, right? So how the functions will come? If I say parasympathetic is arising from craniosacral. So it is called craniosacral segment. And if I say sympathetic is arising from thoracolumbar. So it is thoracolumbar. Another name is thoracolumbar. And parasympathetic is called as craniosacral. Sympathetic is thoracolumbar. So these two I am clear. Now let's see the functions. I will talk about the mainly two glands. First is your parotid gland and the submaxillary gland, their nerve supply. Okay, so here we have got two nuclei, salivary nuclei. It is called superior salivary nuclei and inferior salivary nuclei. So what is happening is superior, S stands for superior, S stands for submaxillary. So it is superior olivary. Okay, so salivary nuclei. This will be inferior salivary nuclei. I am clear? Superior salivary nuclei, the inferior salivary nuclei. Now, if I draw the brainstem here, fine. If I draw the brainstem here, what I have to understand is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. So, how it does? So, this part will be medulla, this part would be your medulla oblongata, pons, midbrain. Now here what is happening is, as I say, superior salivary nuclei. Superior salivary nuclei is one which is found in the pons, and the inferior salivary nuclei is the one which is mainly found in So if it is pons, it should be in the medulla oblongata. Now here what is happening is, the ninth cranial nerve is going to act on the inferior salivary nuclei. That means it is going to act on the parotid gland. But here, so it will be ninth here. So here it is your seventh cranial nerve which is going to act on the superior salivary nuclei. That is, so if it is acting there, it is going to act on the submaxillary salivary nuclei. Now, in short, if whenever there is stimulation of parasympathetic nervous system, it is going to cause vasodilatation. Because of this, okay, so there will be increased salivary secretion. Now, if there is a stimulation of sympathetic nervous system, now as I told, para has come from, it is all from the cranium. So it is called, okay, another name is craniosacral. Now, whenever I say about the sympathetic nerve fibers, okay, sympathetic nerve fibers, they are going to decrease saliva, they will antagonist here. And these fibers, when I see, they arise from the first and second thoracic segments. First and second thoracic segment of the spinal cord. So this is what you should know about salivary secretion. So simple, revising it or just revising it shortly. So how I should know is, so I told you about the glands. There are three main glands here: major glands, parotid, submaxillary, sublingual. Next is how we can classify the salivary glands. Simple, MMS, multimedia messaging. So we have a serous gland, mucus gland, mixed gland. So depending on serous is more thin, mucus is bit thicker. So this is how we can still ahead up. Then functions of the salivary glands: best world dance competition. B stands for body temperature, E stands for excretion, S stands for swallowing, T stands for taste, W stands for water balance, D stands for digestion, C stands for cleaning and the protective action. You have to make it more clear. Now talking about the nerve supply, so we have got two salivary nuclei, superior and the inferior. S stands for superior, S stands for submaxillary. Okay, I will go to the parotid. Now another is, okay, superior is always present on top, inferior is below. So superior is found in the pons and inferior is found in the medulla oblongata. So as I told you, the last four cranial nerves, that is 9, 10, 11, 12, their nuclei is found in the medulla oblongata. So here what is happening is, out of this, the ninth cranial nerve is mainly involved with, okay, with the inferior salivary nuclei, whereas superior is involvement is the seventh cranial nerve, that is facial and the glossopharyngeal. Facial is going to act on the superior, so submaxillary, and the another one, it will be here next nerve, which will be, so parotid I told inferior. Inferior means ninth. So this is how you should be able to present in your answers. So this is how you should remember about the salivary secretions, about the glands and the functions. Okay, thank you.